Hey, Rob Orman here for LLSA 2020, joined by fellow knucklehead Matthew Butterball DeClerc. How you doing, DeClerc?
What's up, people?
And our educational expert, the person who's actually going to know something today, Dr. Mizuho Morrison.
Hi, guys. I'm surrounded by turkeys, birds.
Yes,
Hey.
we are foul today. And MDC, perhaps you're wondering the reasons that we're starting out with foul chickens and turkeys on our head. Perhaps you're wondering.
We'll be talking about foul diarrhea.
Well, you know what? I like your pun better because I was just thinking about it every time that I make turkey or chicken. I'm looking at that knife and that cutting board and thinking, am I going to cook it all the way through? I'm thinking, are they going to get salmonella? Is this going to be the time? Will this be the poopocalypse?
You're just trying to collect on their life insurance. I like that. I always think about it basically, I've never seen a turkey or a chicken or a bird not have diarrheal poop. It's never solid. It's always diarrhea,
all the time.
So it's appropriate.
All the time. All right, Dr. Morrison, over to you.
So will I be calling you Foster and Butterball, or what are we going by?
Yeah, that works for me. Dr. Butterball, please.
Yeah, I'm good. You can just call me Grandpappy, actually.
All right. We're going to dive into our first LSA lecture here, and it's going to be quick and easy. We want quick, easy, and high yield so that you can do really well and score on this exam. All right?
Like
Are you
Rob's
ready?
Diarrhea. Quick, easy, and high yield. I like that. That's my favorite kind of diarrhea.
Yes.
Quick and easy. All right, we're going to first dive into acute diarrheal illnesses, and we're not going to be jumping into that toilet, thank God. But we do see this a lot. I mean, there are 179 million cases of AGE every year, which is just a ton. So we see a lot of this. And the question really is it infectious or not infectious? The first paper that they reviewed was a synopsis of the 2016 American College of Gastroenterology clinical guidelines, and they go over the diagnosis, the treatment, and the prevention of acute diarrheal infections in adults. Now, to be clear, this is only immune-competent adults with acute intestinal infections. That does not include C. diff. We're also not including the elderly and those that are immune-compromised. It's sort of a different beast in and of itself. So the first question is, which patients need antibiotics? And they went through all of their sort of criteria. And the bottom line is that most routine acute diarrheal illnesses, like mild traveler's diarrhea, without fever, without blood, without mucus in that stool, does not need antibiotics. We'll talk about other treatment options. The only time you really do need antibiotics is when the patient has dysentery. And actually, I had to refresh myself as to what dysentery even means. Do you guys know dysentery?
It's the real stinky one. That has blood in it.
Yeah,
blood and mucus, baby.
Exactly. So nasty, bloody, mucousy stool. So if you have dysentery and fever greater than 101 Fahrenheit and a history of traveling abroad, then those are the patients that require antibiotics. And typically azithromycin 1 gram orally, just one dose, or 500 milligrams daily for 3 days is recommended.
Yeah, just take 1 gram, you add nausea to your diarrhea. I like it.
I was going to say, and abdominal pain. So I like the latter dosing. What about antidiarrheals? And we're specifically talking about loperamide here. So should we be giving loperamide? And their answer is yes. And not just for those with dysentery, bloody, mucousy, febrile stools, but also for the mild traveler's diarrhea patients. So their recommendation is truly loperamide for everyone. Now, specifically for those patients who are also on antibiotics, they did a systematic review, and loperamide plus antibiotics actually found to rapidly reduce the number of diarrheal stools, and that's why it's recommended. You can also give bismuth subsalicylate is recommended, but when they did a comparison of head-to-head, loperamide still won out. So I've actually changed my practice to include that.
All right, MDC, I would imagine you were taught, as were we all, that if you give somebody, a human or even a chicken, loperamide with their diarrhea, what's going to happen to them?
They'll never release that diarrhea, and it will explode inside of their abdominal cavity.
Pure explosia. Explosia. Yes. But these guys say, is that okay? Loperamide? What do you think?
Do it, especially if you're on the bus or the airplane or you want to do anything other than sitting on the toilet.
What about antibiotics? That was always a no-go, wasn't it? Antibiotics for diarrheal stools? Like, no, you don't need it. It's maybe increase your carrier state. But it sounds like it's not such a bad idea.
Yeah, I would say like you have one bout of diarrhea. No, I'm not going to jump to the antibiotic. But if I'm, down somewhere exotic and I'm starting to have 2 or 3, I'm going with the antibiotic because I paid for this vacation, man.
So it's not the frequency of stool. It's that you have to have blood and fever. That's when you give antibiotics. All right.
Or severe,
Butterball?
right?
Or severe. Yes. So moving on to probiotics, and this is a question that often gets asked by patients, is should I be taking probiotics? And there's really not enough evidence to suggest that it helps during routine acute diarrheal illnesses. Most of these are viral anyway, right? And so probiotics don't typically help. When it is helpful is after you've given antibiotics, a post-antibiotic associated diarrhea. There is actually strong recommendation for that and moderate level of evidence. And that's simply because you've killed off all the good gut bacteria. And so replenishing that is a good thing. What type of specific probiotic should we be given? No one really knows. There's insufficient evidence. I typically go for, whatever the patient can afford. And sometimes probiotics can be actually pretty expensive. So this is key, rehydration to treat acute diarrheal illnesses. And this is for everyone, right? Because you lose a lot of fluids with diarrhea. So whether the patient is having bloody stools or not is sort of irrelevant. Any patient with acute diarrhea should be orally rehydrated. There's lots of different recipes you can look up, but Gatorade plus water, or you can make your own electrolyte balanced solution. But regardless, hydrate. It's really important. What about preventing diarrheal illnesses? So let's say Butterball de Klerk, you're going to go to Ecuador or some, remote country outside of the US or Europe. And that area happens to be, high risk for traveler's diarrhea. Well, then recommendations for antibiotics are actually given, and you can give fluoroquinolones, which we've poo-pooed over the last few years, right? Or rifaximin. Have you guys heard of rifaximin? Not a drug I prescribe often. But that is actually recommended for prevention of traveler's diarrhea. All right, this is a question that most patients always have, like, shouldn't you test my stool? And the answer is it depends. And really, it's only dependent on certain scenarios. So if you have a patient with dysentery or moderate to severe diarrhea with symptoms lasting for greater than 7 days, then sure, doing culture-independent methods such as a PCR for adult patients is appropriate. What about culture or culture-independent testing? The answer is yes, regardless of those above factors, if the patient has persistent diarrhea greater than 14 days. So if you're having a patient with more than 2 weeks of diarrhea, then sure, go ahead and send off a culture. All right, so in summary, and I'm gonna pimp you guys here, antibiotics plus loperamide is given when?
Severe traveler's diarrhea, I'm gonna say.
And
With
blood.
fever and dysentery. To hold back.
Blood
If
and
you don't have the
fever.
fever, you can chill out. But you can use loperamide if you don't have the bad stuff, but it's got
That's
to be
correct.
the bad stuff.
That's correct. Everyone gets loperamide, so uncomplicated traveler's diarrhea and those with dysentery. Oral rehydration for everybody, and stool testing depending on symptoms and duration.